Hello, my name is Sonia Nettie, and welcome to my relaxation technique. I would like you to keep this phrase in mind during this um, short video that the birds of worry and care fly over your head. This you cannot change, but that they build nests in your hair. This you can prevent. This is a Chinese proverb. So, Exercise and Gentle Movement for Relaxation by Sonia Nettie, NU 646. So, the psychophysiologic relationship. Stress is a natural physiologic response that sounds the alarm for danger, triggering the fight or flight response. Stress increases awareness in dangerous or challenging circumstances. And stress has a negative impact on the body and feels unpleasant. It leads to decreased performance and perceived outside of our coping abilities. When stress is perceived, the brain then signals the body to release stress hormones, creating the physical reaction. And here we'll talk a little bit more about the physical impact of stress. So it can range from different parts of the body, but the nervous system is the biggest point of impact. So the autonomic nervous system plays a major role in the physical response to stress. The sympathetic nervous system contributes to fight or flight response, and the parasympathetic nervous system helps to return the body to the unstressed state. And then we feel the reactions that the body creates, like tense muscles in our musculoskeletal regions, and we have increased heart rate and blood pressure in our cardiovascular system. And some individuals will report vomiting, nausea, diarrhea, throughout the GI system, and of course, shortness of breath and rapid breathing. In the respiratory system. So there's general health benefits to justify the use of exercise as an adjunctive intervention for depression, anxiety disorders, and many other mental health disorders. It is important to note that these exercises can be performed without equipment and is easily transferable to different settings. So some of the gentle movement that can be done is shoulder rolls for 5 times in each direction. So you can just roll your shoulder forward 5 times in a row, and then you can roll your shoulders backwards 5 times in a row. And after doing that, you can also stand up and do kicks to the side. So holding on to the wall or a chair, you can just do lateral kicks to the side 10 times on the left side and 10 times on the right side. And while you're standing, you can then do standing trunk twists. So turn to the left 10 times and then turn to the right 10 times as well. And then while you're still standing, you can do some arm circles as well. You have your arm lift up in the air and then rotate it gently forward and then rotate it backwards as well, 10 times in each direction. This is a great way to keep your body moving. And if those things are not preferable, another thing to do is doing butt kicks. Again, you can hold onto the wall or a chair and do butt kicks for 5 minutes or match in place for 5 minutes. And after doing those things, you can perform like another lunges or for 5 minutes and do some quad stretches, each for 5 minutes, and then tricep stretches as well for about 5 minutes. The whole idea is to do the movements for about 30 minutes. And if none of these are preferable, of course, you can also go for a short walk outside for 30 minutes. And all of these things will keep the body moving and is beneficial. So gentle movement can improve OCD in several ways. Increase blood flow to tissues in the body, aids in significant reduction in OCD symptom severity and depression and anxiety. And exercise can serve as an adjunct to OCD treatment after cognitive behavioral therapy and medication therapy have been instituted as well. So one of the ways to track outcomes is using the Science of Behavior Changes framework. Um, and it can give you a great idea on how long-term outcome for exercise engagement will go. So you will first identify the changeable mechanism in the patients with OCD, and this will include like physical activity enjoyment, positive or negative affect, and behavioral activation. So physical enjoyment is quite important, modifiable target mechanism for intervention, even prior to a formal exercise intervention, according to Shulzani et al. When individuals with OCD enjoy physical activity, they are more likely to engage in the exercise up to 6 months later, above and beyond randomized trials. And these are my references. Thank you for your time.